Hi there, everyone. Welcome to SCB TV Channel 182's new television show, The Dose, presented by Sweet Spot Smiles. The Dose is an engaging new health program that highlights top medical professionals and services in the community. We'll serve up a dose of information just for you. Let's get informed with Sweet Spot Smiles, Resurgence Orthopedics, 360 Med Spa, Sports and Spine Institute of McDonough, Southern Grace Hospice Care, McDonough Family Eye Care, HP Hyde Prosthetics and Orthotics, Eagles Landing Diabetes and Endocrinology, Eagles Landing Family Practice, Eagles Landing OBGYN, Covenant Care Pediatrics, and Mercy Medical. Welcome to The Dose. Episode of The Dose, we will explore the various health concerns of the spine and other key areas of the body. Nagging back pain won't go away? Well, we ask this question and more to our featured medical expert with Sports and Spine Institute of McDonough. Hi there, everyone. Welcome to SCB TV, The Dose, presented by Sweet Spot Smiles. And I'm so excited to have you on this journey to learn more about the health services in our community, right in our backyard. And we're opening up right now with the one and only Dr. Patel. He is with Sports and Spine Institute of McDonough. So excited to have you on the very first episode of The Dose. And what an amazing and fascinating area of medicine you're in, right? So explain what you do exactly.
So I'm a physiatrist, so I kind of look at ourselves as the primary care of sports medicine.
Okay.
You know, the field really stemmed from after World War II. A lot of people were coming back, had brain injuries, spinal cord injuries, amputations, and so a group of primary care doctors actually created a whole hospital for it. And it kind of just snowballed from there. So we started stemming into doing more of the musculoskeletal medicine stuff, which is basically kind of any joint, hip, knee, shoulder, back issues. So we kind of evolved into that, became what I like to consider the specialist in sports medicine and spine care that's non-surgical.
I see. So I've met individuals out and about who will say, well, you know, I had things done to my back or had procedures 20 years ago. Sometimes it didn't necessarily get better, but what I'm so fascinated about is that you shared previously that it's really been a lot of innovation in your area of medicine in the last 10 years.
Absolutely. You know, so besides MRIs and everything else to help us with the diagnosis, I would say the biggest thing in physiatry is getting accurate diagnosis.
Okay.
Right? And so a lot of the accurate diagnosis comes from just taking a great history and doing a great physical exam, and that leads you to getting the MRI. Unfortunately, now in medicine, we kind of jump the physical exam part, get straight to the MRI, and then try to correlate that with symptoms. So that's a great part about what my field has kind of evolved in, is that we do a lot of great physical exam, look at the MRI and say, okay, that matches. And so now with the procedures that we can do spinal epidurals, we can do facet injections. There's even something called radiofrequency ablation. But again, it all stems on the accurate diagnosis and make sure that those symptoms correlate with the MRI. And with the invention of fluoroscopy, which is what we kind of use to guide injections, it makes that even more accurate as well.
Amazing. Yeah. So right now we have a demonstration of the knee. Explain how this works with exercise.
Yeah, so your knee joint kind of moves like a hinge. It does a little bit of sliding, but problem is, your knee takes a lot of brunt of punishment, especially for those that like to run and work out and kind of put a lot of pressure on their legs or stand all day. So what tends to happen is over time you get wearing of not only your meniscus but the cartilage here that lines the knee, and so those spaces get a little bit closer, and that's what we look for on x-rays. So when we see knee arthritis, we know that there's two things that can help a lot with knee arthritis.
Okay.
Two major things that help a lot with arthritis. One is how strong the quadricep muscles are. So you have four muscles that kind of attach to the front of the knee, and they actually help stabilize your knee. So the stronger your quads are, we know from all the studies that that's what slows down the progression of knee arthritis. The other thing is weight loss, like we talked about. Obesity is an epidemic in the United States. For every pound of weight you lose 4 pounds per square centimeter of force through the knee. So it's exponential how much pressure you can take off your knee just by doing that. So strengthening plus weight loss. Huge in knee arthritis.
Now for someone watching us right now in Stockbridge, Georgia, and they're saying, but I have this nagging pain that won't go away, but my next door neighbor, they said they had treatment and it wasn't necessarily effective. But what I'm so amazed by is that it's actually customized, personalized medicine now, right?
Absolutely. So that, and again, that boils down to getting seen, getting examined, and actually figuring out what the problem is. But also going through the steps to help people absolutely learn how to manage themselves, right? So pain is very subjective. Pain is something that we all interpret based on what we feel. We all have the same kind of fibers, but our interpretation of pain is what's different. So some people that little nagging backache
Absolutely.
is just, that's what it is.
Okay.
For some people, it interrupts their entire life,
Oh, wow.
and interrupts their function. And so that's kind of where we fall into place, is that we can help them regain function. And that's kind of what our field stems on. It's not so much how long you live,
Okay.
it's making that quality of life and optimizing that for as long as you live.
Well, right now I know you're holding a model of the spine.
Correct.
So this is amazing. This is what it looks like actually in our body.
To some degree, obviously there's a lot more blood vessels and that kind of stuff and muscles that attach. But you know, your spine is one of the biggest things, a support system for your entire neurological system
Okay.
outside your brain. So all the signals run through there. So
Wow.
what happens when people get nerve pain?
Yes.
Sometimes it's a pinched nerve, sometimes you have arthritis in the joints in the back part, and sometimes it's just wear and tear on your disc that causes this to get closer, and that can cause pressure on the nerves. So again, there's simple things that can be done for that. There's procedures where you can do epidurals, and there's different types of epidurals where you can actually inject into the spinal canal, and you're basically putting a steroid into your spinal canal to try to calm down the irritation to the nerve.
Yes.
You can also go right around the nerve to help calm the irritation directly to a specific nerve if you have an idea of where that nerve's coming from. And again, that stems from your physical exam and MRI. And the people that have that typical low back pain when they're standing for a long period of time, doesn't really travel down the legs, and it's usually kind of at or above their belt line, can often come from the arthritis in these joints. And so again, you can kind of do either injections into those joints, you can sometimes block the nerve that goes to that joint to kind of see if that helps with pain.
Yes.
And if it does, then you can even burn those little nerves to those joints that can sometimes give you anywhere from 6 months up to 2 years of relief of just pain in the back itself.
Wow.
Now, one of the major contributors to back pain is nicotine. So smoking actually increases the risk of disc degeneration and arthritis in the spine.
Wow.
So that's one of the things that we counsel patients on a lot that are smokers that have chronic back pain, is if you actually stop smoking, nicotine will slow down the progression of your arthritis, but also works in your brain and it makes you more sensitive to pain. So smoking cessation can actually reduce pain levels.
Wow, so great information. I have to ask this. I know you certainly want us to be aware of wellness and obesity. Does obesity or extra excess weight impact the spine?
Absolutely. So the more abdominal weight you have, the more it's going to pull in the front part of your spine, the more stress that goes through your spine. So sitting actually puts more pressure through your discs, but standing and obesity will put more pressure through the spine itself, and especially these joints in the back. So core strength and weight loss, especially abdominal weight, can take a lot of pressure off your spine. So we've got to get patients involved in their own health care, and that's kind of what we focus on. You know, I like to think of ourselves as a musculoskeletal cheerleaders as well. I'm really an advocate for patients who are overweight. I talk to them about the diets I do, the exercise I do. You know, and that's a big part of it, right? A lot of people say, oh, well, I can't exercise because my knee hurts, or my back's keeping me. Well, there's other ways to exercise besides running on a treadmill, walking, simple exercises, even breaking them into smaller segments of exercise so that you can still maintain that whole 30 minutes of exercise that they recommend a day without doing it all at one time. So,
which is so important, right? And I love that you are empowering us to do the very best that we can do. Now, I know you all see so many different types of patients here. Explain what sort of ailments your patients may come in with.
So most of the things that we see are spine related, and that's just kind of what gets referred to us. But you know, I'm a specialist in sports medicine, so we take care of anyone with hip, knee, shoulder, ankle, wrist, hand pain. You know, if you're a sports-related injury, I trained in concussion, so I know how to do concussion care. You know, we cover sports events as well. So we're kind of that, again, that holistic, all-encompassing musculoskeletal medicine, and even some neurological disorders. You know, there's patients that we see that have ALS, spinal cord injuries, traumatic brain injuries. Though that's not my subspecialty, our field does take care of that. We are trained in that, so we can always give input for that as well.
Before you leave us, Dr. Patel, I have to ask this. For someone that's saying, you know what, I hear what you're saying, I probably do need the help services, certainly that you're offering and explaining and educating us about right now, but they're saying, I don't want to see a physician, I don't want to have a prescription of medicine, because you know, emotionally speaking, it can make someone think, but am I really that sick long term? Speak to that human component of individuals needing help.
Well, you know, when people need help, the biggest thing is they got to ask for help, and they've got to they want to have to get the help. And so the big key that we try to do is tell people, look, it's not always about a medication. It's not always about seeing another doctor. It's about seeing, hopefully, the right doctor. And hopefully getting on a regimen where you can manage your symptoms without having to come back every week, every month, every 2 months, every 3 months. And that's kind of our goal, is to give you all the tools that you need so you can manage this for the rest of your life.
I love it. The goal is wellness. Stay with us. You're watching The Dose. In the upcoming segment, we spotlight hypertension, diet, and exercise with Eagles Landing Family Practice. ready to reach your goals of wellness? Join us for critical information. Welcome back, everyone, to The Dose, presented by SCB TV, channel 182. I'm here with the one and only Dr. Colin Steele. Now, we're putting the focus today on the silent killer, hypertension. Now, many in your profession know how serious this can be, but someone watching us right now may not be aware of the true dangers. Explain.
So, hypertension is, yes, known as the silent killer, and a lot of people actually just don't know that they have it. So, we really encourage people to come in and get screened because you will not know and may not have any symptoms. Some people come in when they have chest pain, shortness of breath, but what we want to do is actually prevent that from even happening. So if we catch it early, we can prevent a lot of really devastating effects like stroke, heart attacks, vision loss, peripheral vascular disease. There's a lot of things that actually are affected just by high blood pressure that people aren't aware of.
No. So, Dr. Steele, I know we say that hypertension is the silent killer, but we're very much aware of words like stroke and heart attack. And you're saying if these things go untreated, high blood pressure, it could possibly lead to it.
Yes, so over time, actually, blood pressure will actually cause damage in the vessels. So if not treated, you put yourself at a way higher risk to actually either have a bleed from too much pressure in the brain, or the plaque will build up and you can have a stroke from one of those pieces actually breaking off.
Wow, and that's very serious right there. Now, I know like so many of our disease states, we talk about guidelines, if you will, that are set. I know you and your medical colleagues here are very serious about meeting those guidelines. What are the guidelines for blood pressure? Where do you want it?
So our goal pretty much overall is less than 140 over 90. So there's actually different stages of hypertension. So there's pre-hypertension, which is actually considered 120 to 139 over 80 to 89. And then stage 1 is actually 130 to 149 above 90 to 99 diastolic. And then there's stage 2, which is above 160 over 100. So if we can catch people in the pre-hypertensive stage or even stage 1, we're preventing a lot of problems down the road.
Wow. Now, someone watching us right now may be saying, but if I go and Dr. Steele checks my blood pressure, they may already be in stage 2. And they're saying, but I don't want to be put yet on another medication. Explain how it doesn't always mean you have to go on medication. And if so, the options today are much more manageable than in the past.
Yeah, luckily we do have a lot of medications out there now and even combo meds. So we don't have to actually keep continuing to add an additional pill, which people don't like. But then we also counsel them on their diet, exercise, you know, watching their salt intake, being active. Weight loss can actually improve their blood pressure drastically.
I have to ask this now, there's so many disease states and sometimes certain groups are more prone to have it. Is there anyone that's more likely to have hypertension than other groups?
Actually, African Americans are at more risk, and we actually do have to sometimes treat a little bit differently with them. So there's your typical standard medicines that you may use for people that typically work, but African Americans we have to consider other medication treatments.
Wow, and I guess that's why it's so critical to get screened, because I don't want to miss the obvious, but when we say the silent killer, I could have blood pressure issues and not even realize it.
That's right. That's right. And actually 1 out of 3 people right now adults have blood pressure. 1 out of 6 don't even know it. So it's a big deal.
And of course, there's so many services offered by Eagles Landing Family Practice here. Maybe there's a young man, he's 43 years old. He hasn't had a physical or seen a physician or medical provider in nearly a decade. Make a case for him to come in and get screened, especially for blood pressure.
That's right. Anybody, honestly, over the age of 18, you absolutely should be screened for high blood pressure and come in for your physicals, because then we can potentially discover something way early on. And you want to go every year. It's really important. Things can change. You don't know it, but they can change. And then we're there to help you. We'll screen you. We'll treat you if need be. We also have diagnostics available if they need to, so such as an echocardiogram and a stress test. We can do all of that here and really tailor to their needs.
Dr. Steele, so many of us say, but I'm not in pain, right? So why do I have to go?
Yes. So, because we actually will treat you when you're sick. We love to treat you when you're sick, but we actually want to keep you from being sick.
That's right.
And so you don't want to, honestly, we want to see you when you're well yearly, so we can go over everything, make sure that we've answered all of your questions, and that you're aware of your potential health risks in the future. So just coming in for, maybe a sinus infection, we're not getting the whole picture for you.
Okay.
So we really want to treat the whole head to toe.
Stay with us on The Dose. We are serving up some information and much more. Be honest, are you using that salt shaker more than you should? Well, I'm not going to be the one who tells you the truth about it, but the one and only Dr. Vera LaFosse with Eagles Landing Family Practice will be. Welcome. Thank you for joining us.
Thank you for having us.
Now, you know there's someone saying, okay, Dr. LaFosse, I'm putting a little bit of salt on my food. What's the big deal?
The big deal is you're at risk. You're putting yourself at risk for hypertension.
Uh-oh.
You know, many people say, you know, I only just add a little bit, but over time that can actually make huge effects to your meal and to your overall health.
Absolutely.
In general. Yeah.
And so when we talk about the salt shaker, you shared with me previously that, wait a minute, it's not just the salt shaker or putting it inside of that shaker, it's the processed foods that we're eating as well?
Yeah, exactly. A lot of people say, you know, I don't add salt into my food.
Okay.
But they would eat something that maybe is processed either in the freezer,
Yes.
comes prepackaged, unfortunately microwave meals,
Okay.
things like that. Canned foods, unfortunately, how do they preserve it? They
Yes.
put it on the shelf. How do we
Absolutely.
do that? With salt and preservatives. So it's important to realize maybe you may think you're eating healthy because
Okay.
you're not adding salt, but just kind of be mindful of those things that are processed in a bag, in a can, or in the microwave, in the freezer
Yes.
section at the grocery store.
I see. Now we're putting the focus on hypertension, blood pressure. So if someone didn't do that in the past, or it's family genetics to a certain degree, or they're aging, or they just have been diagnosed with hypertension or blood pressure, they come see you or one of your colleagues here at Eagles Landing Family Practice, right?
Yeah.
And they're saying, okay, you've been diagnosed with stage 1. What does that mean? And when is it time perhaps to look at some medical options?
So usually if your blood pressure, just to kind of keep it simple, if you notice your blood pressure is creeping up in the 140s or
Okay.
the 19,
Yes.
you know, 140s and above, over 90s, that's a time to be like, okay, now I need to definitely kind of seek some medical attention.
Yes.
Lifestyle changes like we discussed before, diet, if you are able to get a little bit of exercise in, that's very good. So when they come to see us, we'll discuss those things. If it's to the point where lifestyle changes can help us, but then we have other options such as medications, things like that. Now medications, that's one thing that you kind of have to, you know, find what works for you in particular. What are the kinds of medications we have? That would include medications to help you urinate. You would hear people call it a water pill. And then you have other medications that help your heart rate just get down just a little bit to help your heart not to have to work so hard. Then you have other medicines that work on your actual kidneys. So there's different kinds that can actually help you out, definitely. But you come on over and we'll help you kind of figure out what's what.
And I want to right now horn in on the true danger of hypertension, right? Because it's allowing the body, the heart, if you will, to work a little harder than it's supposed to.
Yes, ma'am.
Explain.
And you know, we talked about it being a silent killer.
Yes.
So the fact that your heart is having to work harder, it leads you to things like stroke and heart attack. So it's very important to have your blood pressure controlled from all aspects. If it's lifestyle modifications, if it's medicine, if it's getting some exercise in, things like if you're a smoker, to decrease how much you're smoking, or to stop smoking altogether. You know, things like alcohol use, excessive alcohol use can actually increase your blood pressure too. So, you know, it's very important to kind of keep all those things in mind to really get a handle of getting the blood pressure down.
Certainly, which is so critical to our health.
Absolutely.
Love that. And we can make a difference in our own lives and be around for our kids and also our grandkids.
Absolutely.
What a joy speaking with you. Well, stay with us. You're watching The Dose.
My name is Amish Patel. I am a physiatrist, which is physical medicine and rehabilitation doctor. I've always had kind of a knack for wanting to know what the problem was and how to help people, and this field just kind of fit. I used to be a physical therapist for 4 years before I went back to medical school, so it also kind of made it just fit very well. You get to spend a lot of time with your patients, get to diagnose them, and then I can also kind of help them with the recovery and teach them how to do things so that hopefully they can manage it for the rest of their lives. It's seeing patients that take control, having that patient that comes in and they've lost 30 pounds because they're doing the diet I recommended, or they've started exercising like we recommended. Talking to that patient that stopped smoking because I really harped on them on how much it's going to affect their whole life. But the greatest satisfaction is really when the patients come back after procedure and they're doing 100% better. They can spend time with their families, they can walk, they can eat, they're not getting interrupted by their pain.
Colin Steele, and I am a family medicine doctor. Well, I think I decided to become a physician just to, honestly, most people do, to help people and really actually make a difference in their lives. I think the biggest reward is actually seeing them achieve their goals. So by us, really honing in on how they will respond to our treatment plans and actually coming up with them together, and then seeing them come back in and they've actually done it. They feel better. We're on a road to a better life. That's the great thing about family medicine, honestly, is that we do build relationships with our patients and we get to know their entire family, which is something that a lot of people don't get to do. And we're involved with them pretty regularly. We know their kids, we know the parents, we know the grandparents, and we know about their lives, where they work, what they do for fun. And it really does make a difference in treating them.